For capillary blood specimen collection, you want to gather all of your supplies. You want to make sure you have your gloves, your gauze, a Band-Aid, alcohol prep, your required microtainers, you're an extender if you are using an amber tube or a red top tube, and also a lavender tube if needed. And then you will be using a gentle heel stick for this collection. The quality of the cutting blade associated to an arc incision ensures less traumatic withdrawals, and compared to the puncture like a lancet used for a blood sugar, which also gives a sufficient amount of blood with a patient who needs a capillary blood drawn. So after you're done gathering your equipment, explain the procedure to the patient, and you want to make sure that you are verifying the patient's name and date of birth. If you are drawing a type-in screen, which the lavender top would be used for, you want to make sure that you also verify the patient's medical record number along with their 2 patient identifiers. When collecting a bullet, you want to ensure that your collections are all the way to the top line. So for our collection, you want to make sure that you're using either the middle or the sides of the middle finger, and if need be, you could also use the ring finger. Never use the index, thumb, or the little finger. So only the middle and the ring finger can be used for a capillary blood stick. So before you get started, you want to make sure that you have your site selected. Go ahead and massage the finger about between 5 to 8 times. Then you will go and get your alcohol prep. Cleanse your site, wherever you're going to use, either side or the middle. You will then take your alcohol. After the alcohol, use your gauze pad to wipe the alcohol off and dry. For this part of the lancet, I will be using some fake skin. With the heel lancet, you will remove the top green part. Then, as you apply pressure to the area, hold down. When it makes that hole, you want to make sure that your fingers are no longer near the sample area. Hold the patient's finger in a downward area and allow the blood to just slowly drip into the container. Do not rub the microtainer against the patient's finger. Just let the blood just slowly drip into the container. If need be, you want to make sure that you can massage the finger. Do not squeeze the finger, as this can cause dilution with the blood and tissue fluid. When you're complete and you have your sample, go ahead and wipe the patient's blood off. Make sure that the patient has stopped bleeding, and then apply a Band-Aid to the area. After you're done, you want to make sure you get your tubes, invert them about 5 to 8 times. For your amber tube and your red tube, prior to placing the label, you would place an extender. So this just pops right onto the bottom, and the label for the lab specimen would be applied. If you have multiple specimens, you may need multiple microtainers. Just make sure that additional lab labels are printed for the specimens. You will not use this collection method for third spacing, edema, cold fingers, or for an ICU patient if they're on vasopressor therapy or TTM post-cardiac arrest. Please see reference list for order test and your collection microtainers.